Okay, so hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. My name is Autumn Sipis. I am the project coordinator with the Canadian Coalition for Green Healthcare, and on behalf of the Coalition, Peach Health Ontario, and Cascades, I would like to welcome you to our webinar, Preparing for Climate Change at Healthcare Facilities, Wildfires, and Smoke. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentations, and our panelists will be answering questions at the end of our webinar today. We are also recording this webinar, and the recording will be sent out to all registrants and will be available on our website and YouTube channel at a later time. I will now hand things off to Linda Varangu to introduce today's topic and speakers. Linda is the Senior Advisor for Climate Change with the Coalition, the Executive Committee Program Advisor for Cascade, and the Climate Lead with Peach Health Ontario. Take it away, Linda.
Thank you so much, Autumn, and welcome everybody to this very important webinar discussion we're going to have today. We all had, likely all of us on this call anyway, had some experience with the events that happened last summer with the fire and smoke, and we are probably going to have a repeat of last summer, which is unfortunate, but that's what all the data is telling us. And in fact, we're seeing the start of this already in Western Canada. We have two wonderful speakers today from Interior Health who have both been through this scenario of fire and smoke in Interior Health. And I'll introduce them both first, and then we'll allow them to do their presentations, and then you can get your questions into the Q&A section, and we'll have a discussion after their presentation. So we'll start off with Jeffrey. Jeffrey Tochkin is graduated in 2010 with a Master of Arts degree specializing in disaster management from Royal Roads University in Victoria, BC. He is currently working in the field of health emergency management in the province of British Columbia with over 14 years of experience in this discipline. Jeffrey holds the Certified Emergency Manager designation and has published articles in healthcare leadership and risk reduction space. Beginning his PhD studies in October of 22, his research looks at the health system adaptation to climate change and building resiliency at the local level through a multi-country analysis. And we're also welcoming Ivor Norlin. He's the manager of drinking water systems at Interior Health. Ivor is with nearly 2,000 permitted water systems, Interior Health provides risk management and administrative enforcement for one of the largest jurisdictions in Canada. Ivor is a professional biologist and environmental health officer and holds 2 bachelor degrees and a master degree in environmental and health studies. Born and raised in Armstrong, Ivor lives in Shiwepmek, got it, in Salmon Arm. Thank you both, and we'll start off with Jeffrey and your presentation. Please take it away, Jeffrey.
Yeah, thank you. Thank you very much, Linda. Just going to share my screen here. And good morning to everyone who has joined, and just really delighted to speak about this for today. So just a really big thanks to the Canadian Coalition for Green Healthcare and the Cascades team and other partners. It's really vital that we share the information and knowledge from the experience of managing climate emergencies, which we are certainly seeing an abundance of here in the province of British Columbia, but also just want to acknowledge that there are active responses, not just within BC, but in other areas of Canada. So wildfire season has started. And as Linda mentioned, we are making preparations, really no different from previous years. However, acknowledging that there could be a rather significant response. And of course, a part of that is recovery. And so I'll speak a bit to those, and also just want to, just a big thanks to Ivor for sharing his experience on water drinking systems. It's not something that is commonly thought about, but certainly is an important topic for the response and recovery from events. So I'm with Health Emergency Management BC, but supporting Interior Health, and just a land acknowledgement here that Interior Health would like to recognize and acknowledge the traditional, ancestral, and unceded territories of the Dekel, Dene, Tanaha, Inkalkatma, Shwepum, St'át'imc, Silks, and Chilcotin nations, where we live, learn, and collaborate together. Also want to acknowledge that I'm calling in today from the Silks territory in what is now known as the community of Vernon, and just an absolute privilege to call these lands home. So for the webinar today, we are going to be covering a summary of the 2023 BC wildfire season, but just to acknowledge again that within the last 5 years, there has been a number of very challenging seasons that we've experienced, again, not just in BC, but other parts of Canada. Also going to be talking a bit about Interior Health, so the profile and some of the system impacts. We're going to go through the cycle of emergency management, so talking about seasonal readiness, so that's really preparedness. There's some mitigation activities that occur. Going to talk about response recovery, then I'm going to hand it over to my colleague Ivor to walk us through the water drinking systems and some of the wildfire considerations and some of the experiences that that team has had. And then we will have a question period. I believe that's going into the chat, so we'll have some further discussion. 2023. So as you can see, there's an image to the right of your screen, and that is a photo from the BC Wildfire Service on the Donnie Creek wildfire. And it's no surprise. So the 2023 wildfire season set multiple records. Again, this is in the backdrop of a 2021 season that was unprecedented in a lot of ways. It arrived early. So it kicked off beginning of April and was a very significant season through to June. And as we saw, the season continued, and fires were continuing to burn throughout the summer and beyond. And so just for some context, the Donnie Creek wildfire was the largest wildfire in Canadian history, which again is very significant. And there are fires that continue to smolder through the winter and have restarted. So just for some context at the size of these and the severity really of these wildfires. Worst wildfire season on record, and even moving to October, 202 active wildfires were still raging through the province. So what we are seeing is seasons that have become much longer and much more intense. And so we'll talk a little bit more about that. As you can see to the bottom right of your screen, there were fires across Canada, literally across Canada. Nova Scotia, perhaps not as many, but they were dealing with significant flooding events. And so I just want to provide that our hazardscape over the past summer was incredibly significant at a national level, and just appreciate that there are a number of folks on this call that are throughout the province. So just want to acknowledge that and really appreciate that. So it's a bit hard to see, but BC, so again, we nearly doubled the total area burned from previous years. And just for some more context, the volume of fires from the BC Wildfire Service areas can be seen there, and we're talking about hundreds of fires. And a lot of these are started through convective activities, so lightning strikes through the province. Unfortunately, we didn't get a lot of rain with that, and so that does complicate things. But just a huge shout out to our BC Wildfire Service at how quickly these are picked up and the monitoring that goes on. So at the peak, so I talked a bit about the fires burned. At the peak, 35,000 British Columbians were on evacuation order and 30,000 on evacuation alert. This is very significant. in terms of not just the health system planning and the continuity of services, but also these are people that likely have been on evacuation order and alert previously. And so I just want to acknowledge the mental health impacts on these folks in the communities across BC and beyond. Northwest Territories is another example of that, and some of the challenges with that evacuation. Interface nature. So we're not just talking about wildland fires, we're talking about interface fires. So losses of structure, moving into more populated areas. And again, it's becoming incredibly complex and a significant resource drain, not just within the healthcare system, but also the BC Wildfire Service, all of the various agencies, non-government organizations that are involved in response. It is becoming a lot more challenging given the complex nature of the fires. There was a fire tornado that was experienced, which was delightful for a lot of scientists, not so much for those on the ground that were battling the fire. And so we're seeing things that we haven't seen before. We're seeing events that have not occurred, and so that is certainly alarming. For those across the country, no surprise about the air quality impacts. There's a photo there of New York City, so not just impacting us here in Canada, but also at an international level as well. So a bit about interior health. So we're located, or interior health is located in the southeast area. It's quite a large geography. It's a very mountainous territory, very rural. There are a number of remote communities. We service 54 First Nations communities within our geography, 15 chartered Métis communities. We serve almost 1 million residents of British Columbia. And just to point some attention beyond the facility map, and there's over 150 facilities, interior health facilities within the region. I really want you to focus on the bottom left-hand corner. And so what you see here is there are a lot of active mental health and substance use clients. There are quite a few home health clients, so those that are in the community. And I just want you to think about the impact for home health clients that evacuation orders and alerts have. And so we'll speak a bit more to that. And also just want to point some attention to the long-term care and assisted living residents as well, who live in facilities that may be evacuated, which we are going to see more of. So some of the impacts, psychosocial impacts on the organization. Over 1,500 interior health staff were personally affected who lived in the evacuation order and alert areas. This is a group, so 1,500, when you think about a staff complement of close to 30,000, including physicians, this is a group that perhaps has evacuated before. So just think about the demands of working in the context of those in the community with mental health concerns, with other needs, the vulnerable populations, and then they themselves are needing to evacuate. So cumulative trauma is a theme, and we're seeing that more and more. And it's not just to our staff, of course, it's to communities, it's to the vulnerable health populations. And it's not just in the context of wildfire. Of course, we think about cold weather, we think about heat warnings. And so really it's a group that is just so incredibly important. And so a lot of planning goes into those groups, including additional mental health resources during wildfires and smoke events. Kelowna General Hospital. So during the wildfires in Kelowna last year, it jumped the lake, so Lake Okanagan, and due to the ember showers from the fire, there was monitoring. The fire department came out to the facility to check to see that there weren't parts of the facility that were on fire as a result of the ember showers. And so really just want to point some attention from a facility perspective. Some of these things that come up that you may not think about, but it's real, and it's something that needs to be considered. And also other staff around interior health, security, facility staff that we're monitoring and reporting those same types of issues. Evacuation repatriations. So we think about getting people out, getting people back in, and to note that due to the volume of evacuations, residents were sent. So for long-term care and assisted living sites, residents were actually sent to another health authority, so to the Vancouver Coastal Health Authority and Fraser Health. So needing to move to the Lower Mainland. And our colleagues, Brent Hobbs from the Patient Transport Office has spoke about this and some of the challenges, and so the work that goes on in terms of that intra health authority relocation, and it's a lot. And we've not just done that within the province, of course, but outside of the province. So 10 LTC facilities were evacuated and nearly 900 people. So just think about the ramifications of needing to move vulnerable, frail, elderly residents to other areas of BC, and the context of family. And you might have families that have had to evacuate as well. We're also seeing compounding and cascading hazards. So I talked about the severity. So we have smoke, we had wildfire, we have heat events, and they are really compounding, and that does create further issues, and really want to hone in on the mental health impacts and cascading hazards as well. So the fire comes, it burns the soil, it creates instability in the soil, and then we are left with landslides, mudslides, and that can be quite challenging from a logistics perspective, getting items, supplies, medical equipment to or from point A to point B. And also staff, that's another challenge, in moving patients. That's something else that has created a lot of impacts within the organization. The Indigenous community health supports. At times during evacuations of Indigenous communities, there's support that's required, perhaps from a medical perspective. And so, and we saw a lot of that this past year. Aquam is a good example of that, and just incredibly devastating events. Even the loss of a few houses really impacts those communities. And so just want to acknowledge that. And a lot of work has gone in to working with those various communities. So in terms of seasonal readiness, so what happened this past year is all facilities within interior health, so it's about 150 during the winter and spring, were mandated to create code gray plans. So what that means is critical infrastructure failures, and as you can see to the left of your screen, that includes quite a few. And of course, Ivor is quite interested in the water or sewer failure, more I think about the water piece. But just to point some attention that during these events, we can lose power that is quite challenging for a variety of reasons, and also some of the air handling system failures. And so some of the work that goes into that from facilities perspective to prepare for it. We also had an acute site code gray tabletop exercise. And so this is really just our cycle of getting it ready, or getting folks ready across the organization for what could come. There's been a lot of work in educational opportunities for environmental sustainability, so building competencies within the health authority. Long-term care and assisted living heat planning, so the BC HARS system, so the heat alert response system, and a lot of work around smoke protection systems. So whether that's hard infrastructure or bringing in filtration systems, air purifiers, etc., to protect populations from the effects of smoke. There's been a lot of work around the governance around climate change and sustainability within the organization, and just a huge shout out to those in the organization that have been leading that work. It is phenomenal. There is a lot of very good work and partnerships that exist with academia as well. There's been integration with Indigenous partners in the First Nations Health Authority in terms of emergency response and evacuations of Indigenous communities and the supports that are required for that. And a lot of attention is paid to the incident command training and exercises within the Emergency Operations Center within the Interior Health Authority. improvements to home health and community clients, alerts and order notifications. So there's actually, this is captured in Meditech, for those familiar with that system, to flag when those in the community may be vulnerable. So clients that may have additional needs in the context of evacuation, that is something that is flagged. And those patients are, we reach out to those patients, we notify them that there is an alert or an order, and have a conversation with them about what their needs are. So in terms of response, just to point out that last year there were significant strides made in terms of intelligence. This has a lot to do with the response and having good awareness of what's happening in the community. So our mapping systems have improved significantly. We need to know where the alert and order areas are in the context of long-term care facilities, of course, acute care centers. But I just want to point out that this was very helpful for us to better understand and also to pay close attention to things like wind direction and our partnerships with Environment Climate Change Canada, with the Emergency Management Climate Readiness Organization within BC, BC Wildfire Service, et cetera, are just paramount in terms of understanding what the situation is, what the forecasts are, what do we need to start thinking about from a health perspective. And that really does help to inform decisions at emergency operations center level. Medical officers of health, surveillance of emergency departments. So again, that intelligence to understand what is the current presentations, what do those look like, what are the trends in terms of issues such as smoke inhalation, etc. Utilization of incident management systems. So this is certainly key to the coordination at different levels within the organization, whether it's at the facility level, at the regional level, or organizationally wide. And this, of course, helps us to plug into what's happening within municipalities, within other local government, within Indigenous communities, and helps to transmit information up to the Ministry of Health as well. Talked about the situation awareness and intelligence products. We're starting to leverage business analysts to help us with some of the intelligence, to put those into dashboards to better inform the organization and beyond in terms of what's happening. And that's really important, that staff have an understanding of what is currently happening in regards to response. And so just want to flag the importance of communication with staff, those who are on the front line. It's very important that they understand what is happening around them, what decisions are being made. The health system presence in regional and municipal emergency operations, so those who are in the emergency management sphere, would understand the importance of that liaison role and being able to highlight some of the challenges within the health system for that collaborative planning and response. And so that is having a presence and in person at times is incredibly important for the rapidity of communications and the accuracy as well. Decision support tools. So I'm just going to talk a little bit about some of the tools that have been developed. These, of course, are available to be shared with those who are on the webinar. And again, just really want to point out there's been a lot of really good work that's been done on these tools. So this is our evacuation or shelter in place decision support tool. And so when you're encountering situations in which you are considering the evacuation or sheltering in place of not just one facility, but it could be a dozen facilities, it becomes really important to have some way to prioritize whether or not to evacuate these sites. And a number of considerations are needed to go through. And these, of course, are designed to build consensus and to allow for support in terms of decisions. And then ultimately it goes up to the senior executive team to make a decision whether to evacuate or not. But this has been a tool that has been just incredibly useful in the context of whether to evacuate or shelter in place. And I just want to point out that, and there's a lot of evidence of this from places in the United States that deal with hurricanes on a regular basis. The challenges with the evacuation of frail, elderly residents and patients. Obviously, the acute care centers, it is a very risky scenario when you're moving ICU patients, for example. So this is a very useful tool in assessing what is the risk, and also having that understanding that if you are to evacuate, there could be some significant challenges with that to the patient population. So I just want to point that out. In terms of response documents, you can see there's a whole list, and these really have been created over the course of a number of years, and really refined and honed based on the experience. So you can see there is a number, the importance of documentation, documentation management, updating the documents, socializing the documents. It's a massive challenge. And so you think about about frontline staff, you think about the sheer volume of information that comes at frontline staff. To find a place for this can be really challenging. And so it's something to think about for organizations that may experience this in the future. The importance of documentation for these, to have a really robust way to maintain documents, and a governance of documents as well. And that, of course, is a part of the Accreditation Canada's standards for emergency management. The importance of lists for sending and receiving sites. So those checklists are incredibly important, and also exercising that as well, that muscle memory for those who are in charge, but not just for that group, but also those that are working within the evacuation themselves. And there's been a lot of products, as you can see to the top of your screen, including evacuation coordinators. So sending out somebody with a physical presence at a site to help to coordinate that evacuation, but also the transport piece, and having transport captains, for example, to really lead that work. And again, that patient transport piece is just so critically important for this. Work and health, or workplace health and safety compliance for deployed staff. So getting to know their site. There can be a lot of movement of staff to support. And so, of course, we want to ensure that there is compliance that is happening. Numerous assessment forms for workplace health and safety, and for facility staff, in terms of pre-season checklists. After the evacuation has been completed, going back into the facility and ensuring that it is safe for occupancy. Once again, forms for road access. This is a challenge that constantly comes up, where access may be an issue, and that might be from wildfires, that may be from landslides that have occurred. And so plugging the organization into Dry BC is one example. So having that situation awareness of what's happening, but also ensuring that staff can move, if safe to do so, to get to work, to support evacuations, etc. So I just want to point that out. That's a really important piece. And then communication templates for public advisories, as those, again, who have been a part of emergency response knows the importance of communications, not just internally for staff, but also externally for the public, so that they can understand what's happening within their community, where they're going, how they can access services in when they're evacuated. And also to point some attention to the importance of including physicians in these conversations, so divisions of family practice, so that physicians who themselves are being evacuated have a place, can support their patients in new communities. So it's just incredibly important to include physicians in the conversation as well, even those that are general practitioners. Again, healthcare needs are may not be more acute at the onset, but as we can see, mental health issues persist, and that also goes for staff as well. You may not see some of the challenges with mental health, but that's something that you start to see a little bit later following the event. So I just want to point that out as well. And finally, recovery. So the staff debriefing, the important, again, that psychosocial piece is not just for the short, medium, and long-term supports, even something as simple as setting up a call center during wildfire season, having staff supported, ensuring debriefs happen shortly after large events, so not just after the response is ended, but during the response, is something that's really key. And Interior Health has done a lot of work to increase the supports. And so just a really big shout out to the workplace health and safety team and others that have had the unfortunate experience of this and really are there to support the staff. Clear understanding of evacuation to reentry integrated process map. Again, this is something that don't expect you to read it, but just know that it's there, and it's something that's really important in terms of that algorithm helping decision making, pointing out some of the resources that exist, and clarifying who's doing what. That's a really important piece, is for those who are designated into roles, whether it's in the Emergency Operations Center or at the front line, to really understand what their role is, and for there to be logic, and for there not to be any confusion in the event of an emergency, because that's when it can be really challenging to maintain focus. And so these quick reference guides are quite helpful. Planning a repatriation of residents. A similar risk assessment is used to the one that you just saw in terms of repatriation of clients. Again, this can be quite challenging. You may be bringing clients back from other areas of BC, or there may be those incoming. Like Northwest Territories is a good example. So absorbing patient populations from outside of the province, and sharing some of these tools that we use within BC to help inform others of some of the considerations to be made when it comes to repatriation of patients. So not just acute care facilities, but also within the long-term care as well. So there's also a checklist for facility reentry, and that's a combined team that does a risk assessment. And with that, I'm going to hand it over to my colleague, Ivor. Ivor, over to you.
Thanks, Jeff. So a bit of a sidebar to step into the drinking water world. So as mentioned right at the beginning, big area Interior Health, and in BC, like it is across Canada, environmental health programs, health inspectors, medical health officers who we report to, responsibility for drinking water safety. But in BC, we actually, the legislation, we're a bit further upstream. So we're directly involved in the regulation and permitting of water supply systems and regulation of them. So just like all these other things, this infrastructure is impacted by climate change and wildfire. So the picture here shows the region again, and each of those little dots is one of those supply systems. And it's something to keep in mind is just the wide variety of community systems we have out there. So right from individual service providers in the community up to small community systems and stratas, right up to city of Kelowna and Kamloops, provide water to the citizens, but also to these healthcare facilities to provide service to the citizens. With our changing climate already, we're seeing this, and it's going to get worse. That's what all the models tell us. We're seeing changes in water quality because of growing seasons and other impacts. We are emerging pathogens, which are new to us being in a northern climate. There are other things we're having to deal with. Drought is actually probably number one discussion right now with our region, less so wildfire, just because of where we're at in the cycle. Extreme precipitation event, because if you don't get enough, you get too much. And 2021, we had what we call an atmospheric river, which is a fairly new term for me, but that caused massive flooding. So we're getting extreme rain events that are impacting our water supply systems at a much higher frequency already. And then as Jeff pointed out, the wildfires. When it comes from wildfires, impacts on water supply systems, community water supply systems, I kind of see it as I've come to see it as a kind of a progression. So the most immediate and common impact is disruption of service. So once you may be on alert, we don't tend to get too worried about alerts. That's just our reality here. But when it gets to an order, so when it shows a red mark on the map and there's an order for people to get away, that impacts right away on the operations of the system. So not only are their staff being required to leave, now they may not be able to do operations as safely as they could or do their regular monitoring. And then there's almost immediately there are drains on the system. So there are fire flows getting out of their normal operation. So right away, there's an impact on the water supply system and safety. And then, of course, as the interface comes and there's burning into the community, that can destroy infrastructure directly, treatment facilities, pump stations, things like that. But whenever a home burns in a community, it usually, almost in every case, will damage what we call the curb stop, and they'll lose pressure. So there'll be loss of water supply, requiring the system to go on an advisory if it already probably was on one. And then long term, so much better researched actually in many places is what happens after a fire. So it's highly variable, but particularly where you have steep slopes and you have maybe a really intense fire that's burnt into the soils, there'll be long-term impacts on water quality in the watershed. And that can have a much bigger operational cost impact over the long term than the actual damage from the fire itself, requiring the community to put in extensive additional treatment or even go to a new water source. It's again a bit of gallows humor, but it's, you know, as we're going through these improvement cycle or these pre-season cycles now with incident command and getting folks ready for the next season, we were always talking about the unprecedented. So 2023 unprecedented, 2021 was unprecedented, 2017 was unprecedented. So it's really just our new reality. In 2021, it was probably a bigger impact actually on our water systems in our region than 2023, even though that was the record one. We had 190 systems that were directly impacted. So that means that they had to be evacuated and or had damage. In 2023, we had 88 systems that were impacted, including 6 that were directly damaged. So in 2021, we actually lost the village of Lytton, including significant damage to the water system, which has just now come back online. And many of these other communities over year, they're still recovering from those impacts. So I think one of the main things I wanted to just impart was the importance of that emergency response cycle. So it's the plan, it's the do, it's the evaluate, and then it's the replan. So I found that as we've gone through these cycles of time, including having a pandemic on top of that, that it's the most important thing is to continually look to get better and learn at each cycle and be formative. And so part of that was us coming out of 2021, having gone through a number of cycles of disaster seasons and pandemics and been on incident command for quite a while. Like, what is it we should be doing better with our water suppliers? And so what is it that constitutes resilience? So very much what Jeff spoke to, like, and for us, it's, can you avoid it? And if you can't avoid it, can you mitigate the impacts? And then ultimately, can you quickly recover? And we anecdotally had seen that there was a very broad range, whether it was impact from floods or fires. Some water supply systems are able to weather that a little better than others, and no matter how hard they're hit, maybe bounce back. Whereas, like the village of Lytton, probably an unfair example, but you know, it takes them years to get back on their feet and to be providing drinking water to their community. So we took the opportunity, got some partners together, and had a student come in. We did some, first of all, started broad. So just go out to the broader world. All those smart people have written lots of things and studied things. What is it that constitutes resilience for a water supply system? So when we're dealing just with that. So we did a literature review and got some best practices out there. We then went out and actually engaged locally, because that's really what our focus was on. So my question was less about what can people from away tell us, but which is important, but what can people here tell us? Because no matter what it may have worked elsewhere, they're going to be specificity to your area, your region, your community, and all the more important to have participation of your knowledge holders locally. So that was really what the study was about, was going out, doing engaged interviews with folks across as best crowd section we can. I mean, you can only do so much. We're not a research organization, but you know, doing that participatory research and having that engagement with the folks. So there is actually an objective, evaluative approach to this. We'll be publishing a paper next month or so with the findings. And where you go through and you look at the how many terms showed up, which were supported, and you can do some statistical basic statistics analysis. So that is all very important. What I really enjoy though, and get a lot of value from, is the wisdom. So there's objective analysis, and then within the paper too, just trying our best to capture the wisdom of the people that are on the ground living in those communities. And the quotes, I mean, just positively reinforcing what is the most important for our communities and our water suppliers, and ultimately the citizens who live there. Takeaway, you get the paper to read all the stuff, but there really was a pretty good alignment the stuff that we found internationally and come to the folks locally. They may have prioritized a few things a little bit more. There's definitely some tweaking. And then it comments more important, I think most importantly, on what is actually feasible for them, given their resources and context. One thing that was actually a big gap we found, and we highlight in the paper, was the importance of proactive management of watersheds. So, I think the industry tends to focus on their water system and what they do for emergencies, what they do for their staff, what they do for monitoring, all that sort of stuff. But, our knowledge holders said, you got to get up into the watersheds in order to avoid, to mitigate, and then ultimately to be able to respond. I mean, be in a position where you can recover. You needed to get out there and be with the land. So to me, being a biologist by training initially, I was like, yeah, it totally makes sense. But it was really encouraging to see that come out of the research. And as much as anything, it was our First Nations community members who were in that interview pool that really reinforced that for us. So just saying, you have to engage with the people on the ground. And there are some very promising work being done now. For example, in the North Okanagan and Vernon, there's a collaborative between the local communities, the water suppliers, and the Silk Nation, looking at, how do we proactively manage our watersheds to adapt? Because I think this is like future state. So every time our systems go through this, maybe they didn't do so well. Maybe they weren't so resilient in the face of this climate change emergency, but they learned from it, and they will adapt and they will come back stronger. And then that needs to expand up into those watersheds. And maybe that's our communities in general, being fire smart and being prepared. But just to bring it back, because I'm talking just about water systems entirely, to bring it back to the facility level, definitely a key theme in that big list of things I had was that this can't just be about the water system, that this is too big of an impact. It's too big of an issue for just water suppliers to be left on their own. They are part of the community. They need to be part of the community response. And so, and subset of that would obviously be the healthcare facilities. So there's an obligation, a need, and an area for improvement for our water suppliers to follow guidelines and communicate with their water users. To have tools like the City of Kelowna uses to have timely information, the right information to all their clients. And that includes the high-risk clients. And so these could be IH-operated facilities, as Jeff's spoken to, but there are also a lot of private facilities out there in terms of care facilities and at-risk clients in the community. But, just re-emphasizing what Jeff said about the code gray and making sure that the folks that are able to then, if we're successful in communicating in a timely way, that they know what to do with that information. So if there's a disruption from, it could be anything that's causing the disruption. It could be a wildfire, but it could be a flood. There could be changes in water quality that could be posing a risk to their clients. That's been an area of challenge for us for a long time. And it's very similar, like I say, you can take best practices from away and say, this is what you should do. And I think that the what I'm familiar with is the US CDC and EPA guidelines for care facilities. That's a 56-page guideline. The guideline is 56 pages. You can imagine what the water safety plan that comes out of it is. To ask 150 or more probably facilities in our region to have massive water safety plans is probably not feasible. They just don't have the resources. They're too busy trying to take care of the people they care for. We're challenged to come up with simple, pragmatic tools in the code gray to say that, you've been told, you just found out you're going on a water quality advisor, you just found out you're in a do not consume, or you just found out there's going to be a restriction in flow. What do you do? And it should be simple and pragmatic. And that's really where a lot of our focus is, as Jeff was saying, an improvement in cycling. But that's really about the water supply. So anyway, hopefully that's helpful. And I'm always available, obviously, afterwards for people to reach out if they want to learn more about it and learn about the paper. But just a quick shout out to our partners, because First Nations Health Authority was really important for facilitating our interviews and being part of this. And then Pacific Institute for Climate Solutions provided a grant to us as well. And then always a shout out to Interior Health, who gives us, Jeff and I, the time and space to do our work. So with that, I'm going to hand it back to Jeff.
All right. I wasn't sure I accidentally turned off my computer and everything disappeared, so I was a little concerned for. So, all right.
Jeffrey,
Linda, you're on mute. There you go.
Did you have any comments following what Ivor was saying about the drinking water?
Yeah, in terms of so the need for, I think, collaboration is paramount. Ivor spoke about this, the importance of the Indigenous stewardship of water drinking systems, including these groups in the solutions, having solutions focused groups that get together, and just want to point out just the impressive nature of the research way of building knowledge, and yeah, it's massive, as we've seen in terms of recovery, and even response. It's very, very challenging to have an effective response if there's no drinking water, if we're having to use bring in other sources. We've seen the challenges of logistics in the context of disasters, and so it's a very important consideration. And really, really pleased to hear that it's being published as well. I think that that's an excellent way, beyond these opportunities such as this webinar, to share the work. And so also just want to point out that the risk assessment and the experience of interior health in the context of moving fragile and elderly patients is also a paper that is forthcoming as well. So I just want to point that out. That will be out in the fall, and that's the Journal of Emergency Planning and Business Continuity. So just want to highlight that as well.
Thank you so much. I just wanted to bring up that when we sent out the invitation to this webinar to folks, we linked to an editorial or post by the Canadian Medical Association, and the topic and title was, "Are you ready? Are we ready for the climate emergencies that are going to be coming our way?" And I wanted to have this opportunity to perhaps help have the attendees reflect on their own situation and consider asking questions about, what are you not ready for? What are the barriers for you to get ready? Do you know how to get ready? We've got lots of information now from Jeff and Ivor, but there are probably some real challenges in having the healthcare system ready for climate change and for wildfires and smoke in particular. So just reflect on that, and perhaps we can take some of your questions along that lines as well. But what I heard was extremely interesting. To get the level of detail that you provided today on how much you have to be aware and prepared for to get ready, because you've experienced this many times before. So this is a great learning opportunity for the rest of the folks on the call. So collaboration, as Jeff, you reiterated again, and Ivor, you reiterated, collaboration outside of the healthcare community is really key, because we can't solve this problem or address this problem alone, and we have to find our key collaborators. So that's really, really important. And the second kind of thing that I wanted to raise again is the idea of mental health supports. And so we see that for the individuals in the community who have perhaps experienced relocation or water advisories or whatever, it could affect their mental health, but also that of the healthcare staff that are helping relocate or helping re-emerge the folks coming back, but also being faced with possible personal evacuation situations at the same time. So we have also the emergency management staff that are keyed into this, but also potentially suffering from these time and time again the experiences that they're going through. So just wondering, at Interior Health, are there special programs to help these various levels of mental health impacts at the emergency level, at the healthcare staff level, at the citizen level? Are there things that you can think of right now that might come to mind as a supports that are being offered?
Yeah. There's quite a few, as I mentioned. There are a number of short-term, medium-term, and long-term initiatives as it relates to workplace health and wellness. And so, certainly from a staffing perspective, and a lot that's happening within the communities with the mental health and substance use portfolio, bridging that with Aboriginal partnerships, working with FNHA. So there's a number of key initiatives, and one of the really important pieces, and this is uh, work that Cascades has been undertaking, is leadership, and not just leadership, but healthcare staff, and building competency as it relates to managing climate change. And that knowledge is so incredibly important in sharing not just the physical impacts of climate change, but also the mental health challenges of climate change, and even at the patient level, sharing that information, sharing that knowledge. Again, building that competency is something that I know within Interior Health that's happening in terms of building courses, building that awareness. But that's also something that's happening at other in other areas across Canada, and it's just very important work to really build the knowledge of healthcare practitioners in the context of climate change. And then specifically in terms of the area that we're interested in, is the managing emergencies and sharing that information, preparing not just our healthcare staff, but also having community members who are preparing themselves, who are helping each other. There's initiatives for checking in on your neighbor during emergencies, and so there's a lot of initiatives that are really designed to help support the mental health aspect and the community wellness. And as we know, resiliency it's a society approach. It's not just one sector who needs to do work within it. It really transcends various levels of government, organizational. Um, it has to break down those silos. It is a whole of society approach to building resiliency, and so that's something that we are having conversations with our partners to ensure that they understand what the needs of the healthcare system are, and also what their needs are as well. And so I think that with that approach, there's certainly not just the initiatives, but having those conversations, doing that collaborative planning, really helps to consider some of those mental health issues that can persist.
Thank you. Okay, I'm going to go to some of the questions that have come up mostly in the chat. So the ability to share the resources, such as the shelter in place matrix tool, that kind of thing. So how would people access the various tools that you shared?
Yeah, so those I'll be sending those to just need to obtain appropriate level of permission. I don't suspect that would be an issue, but those would be going to Autumn, and she can transmit those to those who are in attendance today.
Excellent. Thank you so much. Any information about the HVAC air filtering capacity in the healthcare facilities? Are these being upgraded?
Yeah, it's part of a capital project, system replenishment, really. And so I don't work a lot within that space, but what I do know is there is quite a robust capital project and initiative for upgrading systems. And again, I talked about some of the hard infrastructure, as well as some of the other techniques in terms of ensuring air quality within facilities, especially long-term care, hospital facilities. There are a number of strategies from an air handling perspective that our partners within facilities management and operations undertake, and that really, again, speaks to the work on the critical infrastructure planning. So losses of air quality is one example, which I know those on the call from across the country, this is something that is looked at to protect the air quality within the facility. But it it is occurring. I know that there has been a number of initiatives to improve, and also with new builds taking that into consideration as well.
Yeah, and I just add that it's definitely evolving. And I think one of the things that we've seen is you have to have or should have capacity for those portable air scrubbers. So you do the best you can to retrofit and certainly new builds to have the HVAC system handle the smoke. But you can't count on it. So you're going to have places that need that extra support. And a lot of the work, if folks would go to BCCDC, or National Collaborating Center for Environmental Health as well, I think has some work. But there's been differences of opinion in terms of the medical community as to the overall impact and what the level of intervention should be. But I'm definitely, as we do this, as Jeff said, we're continuously learning, getting better and evolving. There seems to be a more of appreciation, or maybe the tolerance level is dropping a bit in terms of saying, it's smoke. What are you going to do? Versus, you know what? We need to have proactive interventions, and whether that's personal protective equipment, people wearing masks, because we've gone there and back a few times in my time. Yeah, you should wear a mask. No, you shouldn't. It's not helpful. To having those portable air units, which are very effective, and that's where BCCDC might have some very specific information about capacity of those units. And then creating space in communities, and that's probably even more of a challenge. Is that we want to work collaboratively with our community partners to create air shelters. It's heat shelters, right? We have those cooling stations, but also air shelters, and having place for people that don't have access. And it's not just the underhoused. It would be people who are maybe socioeconomically lower in the community and don't have the capacity to go out and buy an air scrubber. They have a place that they can go and be safe, but it's a challenge. There's definitely people pushing back and have concerns about finances and who should be responsible for that. So it's not these collaborations that Jeff speaks to. They're not always comfortable conversations, but we have to be willing to lean into some crunchy conversations about who's responsible for what, and try and get better and better.
Thank you. That does sound like some difficult conversations, especially in very challenging health budgets, for sure. There is another question I just want to raise. What did the healthcare facility, or what will be enacted this year on preventing IAQ from being jeopardized? Were hospitals kept open? Did they use mitigation strategies like IAQ monitoring, ionization, UV? Any comment on that?
Ivor, do you want to lean into this one?
Yeah, I think it's just what Jeff had said earlier in terms of like working with the logistics of the facility managers, all those things. But what you're able to build into the system, whether you have an ionized system, an ionized particulate precipitator built into the HVAC system. But I think that's the main one for me, is that I learned from last year, is you lean in and have those access to those portable units, those air scrubber units. They can give airspace, at least in parts of the hospital or the care facility. And then definitely there's been more and more research being done. There was actually some work done in partnership, I think, with BC Lung this past year and around, where they went into like, okay, this is what we intended to do. This is what we thought would work. Did this actually be reflected in measurement? So they went out and did some monitoring within childcare facilities. And they were quite surprised, unpleasantly, that we had messaging for years that said, don't go outside, keep the kids inside. Because there's smoke, you can smell it. Really hard. IAQ measures, they're a valuable tool at a very high level, but having where those stations are located, those air quality health index stations for monitoring are located, that you're not going to get as best, you're never going to get enough coverage. The way smoke works when you have fires locally, it changes rapidly, way too rapidly to have like, oh, you're on, you're off, you're on, you're off. It has to be almost a personal level. And then so we would say to people, well, if you're worried or you're smelling smoke, keep the kids inside. When they did the measurements inside a cross section of care facilities, they found that the air quality inside wasn't really different than outside. And that's because you're looking at PM 2.5, the really, really small particulates. So yeah, I just reemphasize, let's lean into what Jeff is speaking about. Let's do facility level interventions with HVAC systems and air scrubbing, portable air scrubbers. Cost, money is always going to be a challenge there, but it's what we've learned so far, and yeah, I think unfortunately most other people are going to be seeing more of it across Canada as well.
And there's limited resources. We talk about air scrubbers, for example, and that really speaks to the importance of logistics within that emergency operations center to really have a robust response to be able to move air scrubbers from different facilities at different times. And that's something that the facilities and the logistics team are very, very well practiced in terms of that. But it's also the collaboration with the community and ensuring of resources at times as well. And so just want to point some attention to the importance of those conversations.
Thank you. We've wonderful presentations, great discussions. Thank you so much. We've reached our time limit. I do want to thank Ivor to bringing up the idea of drinking water impacts, because again, this is something that you don't think about when you're thinking about the wildfire season. So thank you for sharing that valuable information with us as well. And Jeff, thank you for all the detail you provided. And I think the participants are really interested in seeing all the levels of the sheets that have been created that they can very well learn from your experience. So thank you so much to both of you for sharing. And
Yeah. I will also extend a thank you and just remind everybody that the webinar recording will be sent out along with the slides from today and hopefully some additional resources as well that people were requesting. So thank you everyone for being here today, and we look forward to doing this again. Take care.
Thanks.